tremendous interest in global health. These 4 universities listed here created an informal consortium to support and investigate global health training and careers, and specifically looking into a fellowship training program. In fact, the consortium that was created, there is a consortium that was created to do this training. There's an information session about it that's in your handouts and your materials, and then there's another presentation tomorrow about the consortium. One of the first things that we did was to start looking at, well, what do we know about trainees at summer schools or through universities, I should say. So to accomplish this, we decided to do a survey. We decided to investigate career interest, interest and barriers to training experiences, and possibly interested in fellowship training programs. To accomplish this, we did an anonymous survey that we administered to the trainees at 4 target programs: medicine, public health, and nursing. The medicine included both students and residents, and the questions addressed interest in global health as a career, participation in relevant activities, coursework, perceived obstacles. Some of the questions were applicable to everybody, and we did a battery of questions on specific to training programs. So this is our initial data about respondents and so forth, and you can see that we had almost 2,100 responses. The actual number of trainees in the 4 schools or the 4 universities in the multiple training programs is actually 11,000. So the response rate was 19%. It's really high. And we say that at least 14% had traveled overseas for some reason other than just going on vacation. Now we say that it's formative because 80% of these people went to developing countries. 38% of all of them have stayed for a year or more, and this was the most commonly cited purposes of traveling, and they're certainly relevant to global health. So the other thing is that we found that there was a very high interest in global health as a career. 54% of the respondents were interested in the career in global health. At least 10% of all the trainees are interested in a career, using that same calculation I mentioned before. We think in both cases it's an underestimate, but we don't know what everybody else would say, so have trouble figuring out what the magnitude of that underestimate really is. The one thing that I found really very interesting is that 61% of the people who were interested in a career in global health said that the primary reason for them going that direction was a previous overseas experience. We asked several, we had a multi-choice question. The next closest number was 12%, and that was for people who had actually done some global health work overseas. So in terms of just following up on career interests, these are the areas of interest that were most frequently mentioned. There were others. By the way, I should mention that somebody had asked me about whether Peace Corps was important. And Peace Corps did show up, but nowhere nearly as high as that. In fact, it was less than the 12% that I mentioned before. So this is what the folks who responded said they were interested in doing if they pursued a career in global health. And to some people's dismay, research turned out lowest, or not lower, among the highest ones. So there's also, we think there's a high interest in overseas experiences. 50% of these experiences would be not necessarily credit-bearing experiences. 50% have completed or pursuing a short-term experience overseas. 58% interested in completing an extended research fellowship. 75% were interested in some sort of post-degree, between degree program. However, 75% of those said they were interested only if there was support, which I suppose is not terribly surprising to you. Here's a slide that's got information about pursuing courses or rotations. There's a lot of data on this slide. I think the take-home message is that there's fairly high interest in a wide variety of kinds of global health training programs. These would be career credit-bearing for the most part. There's also some interest in special training programs. We asked medical students if they were interested in a residency involving rotations overseas. 62% said they were interested. However, we asked the question slightly differently. We asked them if they would participate if it extended their training period for a year, and that knocked back the percentage a bit. Although very nice to see that 40% said they would, but 33% weren't, and the primary reason was extension of the training period itself. The other thing is that we asked medical residents if they're interested in a certificate or MPH in global health, and there's a high degree of interest, but as you can see, 37% said they were interested only if they had some sort of grant or scholarship support. So the other thing that we found that we're kind of concerned about is that there are gaps in information about school-specific training offerings. So we asked the students if they were interested in certain things, and we had responses saying that they were not sure if these specific things were available in their schools. And you can see fairly high percentages in some cases, particularly the extended research practices. And this, basically what this says is that we don't have enough information out there for people to go and look it up and say, yes, I do know that there is or there is not. Similarly, we found that there were barriers to participation as well. The percents are a little bit lower, but you still have a number of people saying that they can't participate in certain activities and offerings. And the primary two things that came up were funding and time, which I suppose also was not a terribly big surprise to most of you. So, the limitations of what this survey has to offer is that it's a low response rate, and I wouldn't want to go and extend the data too much. However, and there's also a corresponding likelihood that the people who responded were interested in global health. However, I think the numbers are really convincing, and particularly the actual magnitude of people who are interested in a career in global health. And some of the findings, like the prevalence of barriers, are fairly representative, we believe. So in summary, there's a high degree of interest in global health as a career, high prevalence of overseas travel. Previous travel appears to be a gateway to global health career interest. There's a high interest in global health training and experiences. There's several challenges, people being unsure about the availability of training options. We think that probably could be resolved by additional information resources, and I can say personally we're starting to look into doing that. And then there are some people that are unable to participate in offerings, funding and time being the primary ones. Difficulty in arranging these experiences also fairly important. So, my acknowledgements, I'd like to acknowledge my co-authors, Chris and Suzanne, the consortium leaders, and as well as thanking Nancy and Alitra for helping with the data. Thank you.